today. Our chief guest for today is Mrs. Daisy Jacob and Miss Reshmi Bobin. Reshmi Bobin, madam, is yet to join. We have Mrs. Daisy Jacob here. Mrs. Daisy Jacob is, as we all know, wife of former Minister Sri T.M. Jacob. Madam was the treasurer of ABHA for the past 30 years. And in 1985, she started the ABHA Foundation along with Sri Sugata Kumari, a place for mental people with mental illness and a home for destitute women. ABHA has expanded to cater to women and girls who have suffered various kinds of abuse. And she has been a strong support along with Sugata Kumari to start the foundation of ABHA. Madam is also actively involved in IRIA Foundation, another voluntary organization based out of Trivandrum, and it has played an important role in supporting cancer patients for the past 22 years. I request Daisy Madam to address the gathering.
എല്ലാവർക്കും നമസ്കാരം. സ്വസ്തി ഫൗണ്ടേഷനും താരസംഘടനയായ അമ്മയും IRIAയും ചേർന്ന് സംഘടിപ്പിച്ചിട്ടുള്ള ഈ ബ്രസ്റ്റ് ക്യാൻസർ അവയർനെസ് പ്രോഗ്രാമിന് എല്ലാ ആശംസകളും നേരുന്നു. എന്നെ ഈ ചടങ്ങിലേക്ക് ക്ഷണിച്ചതിന് അതിനുള്ള എൻ്റെ സന്തോഷവും ഞാനിവിടെ പറയട്ടെ. സ്വസ്തി ഫൗണ്ടേഷൻ എബി ജോർജിന്റെ നേതൃത്വത്തിൽ ഒരുപാട് കാര്യങ്ങൾ, ശ്രേഷ്ഠകരമായ ഒത്തിരി കാര്യങ്ങൾ സമൂഹത്തിന് നൽകുന്നുണ്ട്. ഈ ഒക്ടോബർ മാസം ലോകം മുഴുവനും ബ്രസ്റ്റ് ക്യാൻസർ അവയർനെസ് മന്തായി ആചരിക്കുമ്പോൾ നിങ്ങൾ ഇവിടെ സംഘടിപ്പിച്ചിട്ടുള്ള ഈ ക്യാമ്പയിൻ അതിന് ഏറ്റവും ഏറെ പ്രസക്തി ഉണ്ടെന്നുള്ളതാണ്. ക്യാൻസർ രോഗം വന്നാൽ എത്രയും പെട്ടെന്ന് ആ ഇനീഷ്യൽ സ്റ്റേജിൽ തന്നെ ഡിറ്റക്ട് ചെയ്യുവാണെങ്കിൽ അതിനുള്ള ട്രീറ്റ്മെന്റ് നടത്തി സുഖം പ്രാപിച്ച ഒരുപാട് പേരെ നമുക്കറിയാം. സാധാരണയായി സ്ത്രീകളിലാണ് ബ്രസ്റ്റ് ക്യാൻസർ കൂടുതലും കാണുന്നത്. പക്ഷെ നമുക്കറിയാം, സ്ത്രീകളാണെങ്കിൽ അവരുടെ കുഞ്ഞുങ്ങളെയും ഭർത്താവിൻ്റെയും കുടുംബത്തിൻ്റെ എല്ലാം കാര്യം നോക്കുമ്പം സ്വന്തം കാര്യം, അവരുടെ ആരോഗ്യത്തിൽ ശ്രദ്ധ വെക്കാൻ അവർ മെനക്കെടാറില്ല. പക്ഷെ അവരും വിചാരിക്കേണ്ടത് നമുക്ക് ആരോഗ്യം ഉണ്ടെങ്കിൽ മാത്രമേ മറ്റുള്ളവരെ സഹായിക്കാനും ശുശ്രൂഷിക്കാനും പറ്റുകയുള്ളൂ. അത് തന്നെയല്ല, അവര് മറ്റുള്ളവർക്കൊരു ഭാരമാവുകയും ചെയ്യരുതല്ലോ. അതുകൊണ്ട് ശരീരത്തിൽ എന്തെങ്കിലും അസാധാരണമായിട്ടുള്ള തടിപ്പോ പനിയോ വേദനയോ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ഉടൻ തന്നെ ഒരു വൈദ്യോപദേശം തേടുന്നത് ഏറ്റവും നല്ലതാണ്. അങ്ങനെ ക്യാൻസർ വിമുക്ത കേരളത്തിനായി, ക്യാൻസർ വിമുക്ത ലോകത്തിനായി നമുക്ക് ശ്രമിക്കാം. അതിനായി പരിശ്രമിക്കുന്ന ശാസ്ത്ര ഗവേഷകരെ അവരുടെ വിജയത്തിനായി നമുക്ക് ആശംസിക്കാം. ഇന്ന് സമൂഹത്തിലെ എല്ലാ വിഭാഗം ജനങ്ങൾക്കും ക്യാൻസറിനെ കുറിച്ചുള്ള പരിശോധനയും അതുപോലെ ഈ രോഗം വരാതിരിക്കുവാനുള്ള മുൻകരുതലുകളെ കുറിച്ചും ട്രീറ്റ്മെന്റിനെ കുറിച്ചും എല്ലാം അവരൊക്കെ ബോധവൽക്കരിക്കേണ്ട ആവശ്യമുണ്ട്. നമ്മുടെ കേരളത്തിൽ തന്നെ ധാരാളം സന്നദ്ധ സംഘടനകൾ ആരോഗ്യ രംഗത്തും സേവന രംഗത്തും എല്ലാം പ്രവർത്തിക്കുന്നുണ്ട്. അവരുടെ എല്ലാം സേവനം നമ്മൾ പ്രയോജനപ്പെടുത്തണം. ഇന്ന് ഈ ക്യാമ്പയിനിൽ തന്നെ നമുക്ക് ഈ ക്യാമ്പയിനിൽ കൂടെ ഒരുപാട് വിദഗ്ധരായ ഡോക്ടർമാരുടെയും മറ്റ് എക്സ്പേർട്സിൻ്റെ എല്ലാം നിർദ്ദേശങ്ങളും അഭിപ്രായങ്ങളും എല്ലാം നമുക്ക് ലഭ്യമാണ്. അത് പ്രയോജനപ്പെടുത്തണം. നിങ്ങളുടെ സുഹൃത്തുക്കളും അതുപോലെ മറ്റുള്ളവരെ, മറ്റ് ബന്ധുക്കളെ എല്ലാം ഇത് മനസ്സിലാക്കി കൊടുക്കുവാനും ഇത് ശ്രദ്ധിക്കുവാനും ഇത് പ്രയോജനപ്പെടുത്തുവാനും ശ്രമിക്കണം. സ്വസ്തിക്ക് ഇത് സംഘടിപ്പിച്ച സ്വസ്തി ഫൗണ്ടേഷനും അമ്മയ്ക്കും IRIAയ്ക്കും എൻ്റെ അഭിനന്ദനങ്ങൾ അറിയിക്കുന്നു. ഈ ക്യാമ്പയിൻ ഏറ്റവും പ്രയോജനപ്പെട്ടിട്ട്, ഒരുപാട് പേർക്ക് പ്രയോജനപ്പെട്ടിട്ട് അവർക്കത് അനുഗ്രഹമാകട്ടെ എന്ന് ആശംസിക്കുന്നു. അതിനായി പ്രാർത്ഥിക്കുന്നു. നന്ദി, നമസ്കാരം.
Thank you so much, madam, for those words of wisdom and encouragement. With that, let us start the academic session for today. We have the first session by Dr. Sara Isho. Madam is a medical director and consultant oncologist at KM Cherian Institute of Medical Sciences. Over to you, madam.
Thank you very much. Can you hear me?
Please invite Jaykumar sir to chair the session.
Yes, we have Dr. Jayakumar. Sorry, we have Dr. D.K. Vijaykumar, sir. Sir is a professor and head of Division of Breast and Gynae Oncology, Amrita Institute of Medical Sciences, Kochi. Sir needs no introduction in the Oncology Society. Sir is the teacher of teachers. He has taught everyone from the leading oncologists today. He was the first to introduce breast conservative surgery along with sentinel lymph node biopsy in India as well as in Kerala. I request D.K. Vijaykumar sir to chair the session.
Thank you very much for having me here, and it gives me great pleasure to be a part of this movement. For this month, Breast Awareness Month, I'm sure this is going to do a lot of good. This is awareness is the most important aspect that we have to spread the word around. So without much ado, I know Sara Iso personally, and hi Sara, and it's a pleasure to be in the part of this group. So let's go to the academic session straight away, and let's hear from Sara.
Thank you very much, Dr. Vijaykumar. I want to thank the organizers for having me here today. I was listening to a few of the webinars. It's been very informative, and this is really commendable that you're doing this informational sessions throughout the month of October. I am really happy to be a small part of this big attempt. So I am going to share my slides. Can you see my slides?
Yes, ma'am, it is visible. Yeah.
So the topic for today is the challenges in the physical and emotional healing during chemotherapy, a journey with the patient and the oncologist. So the last couple of days, we have heard from experts as to the use of chemotherapy and immunotherapy in breast cancer. So to recap, most of the time when the patient have early breast cancer and they have surgery and they come to see a medical oncologist, the first question they are asking is, do I need chemotherapy and why do I need chemotherapy? The surgeon said that they took everything out, so I don't have any cancer in me. What is the need for having chemotherapy at this point? So there are two main instances where chemotherapy is used in the treatment of breast cancer. One is early stage or localized breast cancer. At that time, the intent of treatment is a cure. So it's given as a curative intent. And this can be given either before surgery or after surgery. So before surgery, it's called the neoadjuvant or preoperative chemotherapy. Its main goal of neoadjuvant chemotherapy is to shrink the tumor so that the surgery can be facilitated better. And also in certain cases, such as triple negative or HER2 positive breast cancer, the neoadjuvant chemotherapy will help to improve the outcome as well. Adjuvant chemotherapy is referred to when the surgeon removes all the cancer. There are no visible cancer in the body, and the tumor in the breast as well as the lymph nodes are removed. But still, some people, based on their stage and certain features, need chemotherapy. So that's the question to answer. Why do I need chemotherapy in that stage? Because depending on the stage and certain features, there is a risk of cancer coming back or a relapse. because there could be cancer cells in our system, in our body, which cannot be seen. And that cancer cells, after years, months, or years later, can deposit to other areas. It's a process called metastasis. So to prevent metastasis, people need adjuvant chemotherapy based on their stage and certain features. The second time where people need chemotherapy for breast cancer is when it is metastatic. So when the cancer is already spread to other organs, chemotherapy is used along with other treatment measures. And at that point, we are not able to get a complete cure, but our goal is palliation, to prolong the lifespan of the patient, as well as to control the symptoms from the cancer. So these are the two main reasons why chemotherapy is used in breast cancer. So what are the challenges for someone coming for cancer treatment? Especially when somebody is diagnosed with breast cancer and they are going to see a medical oncologist, they are very afraid of the word chemotherapy itself. I think the word chemotherapy has as much as a stigma as cancer itself, because in our mind, chemotherapy is pictured as somebody who is very thin, emaciated, with no hair, either curled up in bed or vomiting tremendously and not eating. So those are the kind of pictures that we have painted in our minds regarding chemotherapy. So it's always the fear of the unknown. You don't know what medicines you're going to get. You don't know how you're going to feel. So that's one of the biggest challenges that patients feel, as well as the doctors feel, to convince the patient that chemotherapy is needed and is not something that has to be feared of. There's, of course, concern about the side effects, but there's also financial constraints. So in our setup, not everybody has a health insurance, so people have to pay from their pocket for their chemotherapy treatments. Of course, some of the chemotherapy medicines can be very expensive, but unfortunately, most of the medicines that are used for the common breast cancer in the early stages are not, they're tremendously expensive. But patients are always afraid about the financial constraints, and there's a lot of false beliefs and myths. And everybody will have something to say when somebody tells them, I have cancer and my doctor said I need chemotherapy. Most people will have something to say, which these are people who are related to the patients or their friends, and whoever come across them, they always feel like they have to say something. But so most of the time, this unnecessary advice from the family and friends can be more detrimental than useful. So a patient, as well as the doctor, has to face all these challenges before they start the chemotherapy itself. So once somebody has a diagnosis of cancer, even if whether it's breast cancer or anything else, it's very important to follow certain steps. You have to assemble a medical team. You have to make sure that you have trust in your doctor and the team, and you have to make sure that the hospital that you're dealing with has appropriate equipments and appropriate measures to deal with the side effects of the treatment. You have to make sure that your medical team is available in case of any side effects or any other concerns you have. Then you have to understand the treatment options. I mean, we are, this is a very literate society in Kerala, so we have to be an informed consumer. We need to know what kind of treatment options are out there, and what are the options, what are the treatment options that are applicable to you specifically. Then you have to make sure that you manage your stress. I know it's very difficult to manage the stress because you are already in a stressful situation. Then you're hearing from everybody about all the negative things. So it's in the midst of all that stressful environment, it's very important to keep a calm and stress-free mind, so that you can deal with the actual problems of the cancer and the treatment itself. Then it's always important to maintain a physical health, control of other medical problems that you may have, eat healthy, and control your blood sugar, control your blood pressure. That kind of medical problems has to be also dealt with. So the side effect of chemotherapy, the short-term side effects of chemotherapy is something that you experience while you're getting chemotherapy. So nausea and vomiting, everybody knows that chemotherapy can cause nausea and vomiting. But fortunately, in the last 2 decades or 3 decades, there has been tremendous improvement in the supportive care of oncology, so that very few patients get a severe vomiting or nausea and that needed intervention such as a hospital admission or hydration. About 3 decades ago, when I started oncology training, there were only a handful of medications in the chemotherapy section, and there were very few medicines to control the nausea. But there's been tremendous improvement in the field of oncology. Now we are getting hundreds of medicines approved every year, and there's been tremendous progress in the supportive care, especially controlling vomiting. So in this day and age, even though the medicines that are used for the treatment of breast cancer can cause nausea and vomiting, we don't see that much because we have a lot of good preventive medicines to control the nausea. Some people get diarrhea. Fatigue is a very common symptom. They can be either from the cancer itself or from the treatment. Low blood counts, because just like chemotherapy kills the cancer cells, it can kill the rapidly dividing cells. So most important thing is the cells in the bone marrow. So it affects the bone marrow cells. So it can affect all 3 bloodlines, which is the red blood cells. If that is lowered, people become anemic. If the white blood count is lowered, there's a risk of infection. And if the platelet count is low, you can get bruising and bleeding. And of course, there's a risk of infection when the white blood count is low. And then hair loss is one of the most common side effects, especially most of the medicines that we use in the early stage breast cancer can cause hair loss. Some people can get mouth sores, and some of the medicines that we use in early stage can also cause a numbness, neuropathy. So how do you manage these side effects? It's important to know that any symptoms that you have is a side effect of the treatment, and we have to know what kind of measures you can do to alleviate the symptoms. Even if you cannot get rid of it completely, what can you do to manage the side effects so that you can continue the treatment? So in terms of the fatigue, which is very common in most patients with cancer treatment, there could be sometimes correctable causes like low blood counts. If you are anemic, people can be tired, or it could be something like dehydration or low potassium, low sodium. So it's always important to know if there is a correctable cause of the fatigue. And then, of course, symptomatic management. We have to make sure that you take enough rest, take short naps, but at the same time, don't be in bed all the time. It's, even if you're tired, we recommend that people go for short walks. So take short naps if you're tired, but take short walks also during the daytime. Then, with the nausea and vomiting, like I said, there is a lot of improvement in the use of antiemetics. So that is not a major issue, but we have to make sure that the doctor prescribes the antiemetics for you to take when you're home, and you have to take it without a delay. At the onset of nausea, these medicines have to be taken so you don't end up vomiting a lot. Then for the low blood counts and risk of infection, the hospital admissions with severe infections has been lowered by the use of growth factors called the GCSF. These are growth factors that stimulate the production of white cells. So that will help to reduce the risk of infections. Then hair loss is mostly inevitable. There are modern techniques like scalp pulling techniques where you wear like a protective mask which has a coolant in it, and that can reduce the amount of hair loss, but it's very expensive, and also it does not completely protect from hair loss. But the bright side of hair loss in early stage breast cancer is that the chemotherapy is only for a limited number of months, and after that, whatever hair you lose will come back. And I've seen some people, it even comes thicker and stronger. So it's we have to make sure that the patient feels that it's temporary and it's going to come back. In the meantime, you can manage with a short haircut or wear a wig. Then neuropathy is also a common symptom which can be which has to be detected, and also it has to be managed appropriately. It may not, unfortunately, some of the neuropathy can be permanent. So it's important to identify the neuropathy before it becomes worse, so that you can adjust the dose of the medication. Long-term and late side effects is also important, because now that we are detecting breast cancer early, you're going to have a lot of women who had breast cancer treatment and going to be living a normal life after that. So they also have challenges. They have also side effects that are long-term, which can begin during treatment or shortly after treatment and can last for months. Or there can be late side effects, which starts even months or even years after treatment. So it's important to identify the side effects and direct them, so we can control those, and so that you can ensure an appropriate quality of life. So in cancer treatment, it's always important to maintain the quality of life. Quality of life means an overall well-being, right? So it's adequate mental and physical health and ability to perform daily roles. Other issues, other factors such as sexual function, pain, and other side fatigue, all these things play an important role in someone's quality of life. And also non-health related issues such as financial and social issues also play a role in defining somebody's quality of life. So some of the late and long-term complications, again, neuropathy that starts during chemotherapy can last for a long time. Some of it can get better with time, but sometimes it can be debilitating. Some of the medications can cause toxicity to the heart. So it's important to monitor your heart function even after chemotherapy is done, periodically checking up for the heart function. There's also a lot of sexual dysfunction that can happen after breast cancer treatment, mainly people go into premature menopause, and it can cause hot flushes, which can be disturbing. Also, vaginal dryness and decreased libido, all those things can be a side effect of breast cancer treatment. And some people can have infertility, and this also psychological implications of having breast cancer itself, which sometimes it can last longer, and the anxiety, the depression, cognitive dysfunction, such as some people you call it as a brain fog. So you cannot remember things properly that you used to remember well in the past. So they say that I have a chemo brain, which is a real thing. Some people do complain of having a fuzzy feeling confused at times and not able to remember things properly. Osteoporosis or thinning of the bones can happen from the treatment, and rarely, but after several years, there is a risk of having second malignancies, probably as a result of some of the chemotherapy medications. So these are some of the potential complications that can happen after, even after years after completing the breast cancer treatment. So we used to think that pregnancy is not safe after breast cancer. Now that more and more younger women are diagnosed with breast cancer, they may not have finished their childbearing years. This question always arises, can I have a baby after I get treatment for the breast cancer? The answer is yes. We used to think that it was risky because we thought that the breast cancer will relapse during pregnancy, but that's not the case. So many studies have shown that you can have a safe pregnancy after being treated for breast cancer. It's safe. We usually tell patients to wait until 2 years after they finish treatment, especially if they are on hormone treatment, hormone receptor positive breast cancer. We wanted them to at least take 3 years of hormone treatment, then interrupt the treatment while they are pregnant, and then resume it after they give birth. But of course, there is challenges for someone who had breast cancer. They may have incidence birth weight and fetal disorders, or low gestational age for the baby. But it's doable, and it's been done many times. So again, psychosocial challenges like depression, anxiety, fear of recurrence, cognitive impairment, and then social issues such as feeling isolated from the rest of their colleagues and friends, because our society has a tendency to play a role of a sympathetic person, but at the same time not including people who have cancer or who are undergoing cancer in their midst, because they feel like they have to be isolated. So that can also cause some psychological and psychosocial challenges for the patient. And then, of course, with the breast cancer treatment, there's a low self-esteem and body image issues that comes with the treatment and the surgery. So I want to describe a journey of a real life patient. This is one of my patients who was diagnosed in 2007. She has given me permission to share her story with others. She was diagnosed with stage 2 triple negative breast cancer when she was 29 years old. At that time, she had given birth about a year and a half ago. Her baby girl was 18 months old, and she was still breastfeeding. So this diagnosis of triple negative breast cancer came as a shock for her. But she had to be treated. So it was triple negative and it was locally advanced. So we treated her with neoadjuvant chemotherapy for 8 cycles. And after that, she opted for bilateral mastectomy and reconstruction. During the treatment, she had complications like neutropenia, which was managed properly. When she had complete alopecia, she lost all her beautiful blonde hair. But she had no other major medical complications, but she had a very emotional time. So she had started her family life with her boyfriend, and this happened. So this was a very traumatic emotional experience for her. But she had a lot of family support from her house as well as her boyfriend's family. So of course she was not able to work for some time, and she had financial constraints and difficulty in caring for her baby. But after the treatment was completed, she comes for follow-up every 6 months. So during her follow-up visits, the main concerns are her numbness in the feet, which is still persisting a little bit, but it's slowly getting better with time. There's always a fear of cancer relapse, especially in the first couple of years. She was always afraid. Each time she comes to the office, her main concern is the cancer coming back. Then she has had fatigue for some time, and she was not able to go back to work. And of course, the family dynamics changed because she was not feeling well, and that can cause a lot of strain on a normal family. But most of all, at that time, after a couple of years, when she was less afraid of the cancer coming back, she wanted to have another child. So by that time, she was only like in her early 30s. So we were skeptical because she had triple negative breast cancer, which has a high chance of relapse. Not that having a baby is going to affect her health, but if she gets cancer relapse, and that's probably going to be difficult with two little kids. But she and her husband by that time were adamant about having another baby. So after 4 years, she had a baby boy, and she had a normal delivery. So right now, it's about 15 years later. She's working full time. Her daughter is almost an adult now. Her son is going to high school. So these pictures are from a baseball game. She was chosen to throw the first ball at the baseball game. And I was invited along with her, being her oncologist, to support her. I don't know anything about baseball, but I went to support her. So she's having a very normal life with a happy family, and she's enjoying with her beautiful children who are now going into adulthood. So she still comes for follow-up every 6 months. So once you finish treatment for breast cancer, there are certain things that we need to know. The treatment is over, but the visits and the follow-ups does not end. You have to make sure that you get a treatment summary. Either the doctor can give you a summary, or you can do it yourself. Include details of all the cancer-related treatments, including the date of surgery, kind of surgery you had, what kind of chemotherapy you had, and details about the pathology report. Everything has to be summarized so that when you go to visit your next doctor, they can have that for immediate review. We have to make sure that you get breast cancer related follow-up visits even after the treatment ends. Some people think that after the treatment ends, you don't have to see the doctor, but most people go the other way around. When you're getting treatment, you're seeing your doctors very often, but when the treatment is done, you're not seeing them that often. So they feel kind of left out or have like a withdrawal kind of feeling because they want to make sure that they are cared for even after the treatment is done. So it's important to have follow-up visits, regular 3 or 6 months visits, depending on the stage of the disease. We also have to make sure that you're aware of other conditions that can happen during this surveillance period, and you have to know how, especially like cardiac issues and neuropathy. Then also you have to know about possible treatment-related side effects, and also you have to make sure that you have a healthy living habits for your situation. One thing I haven't mentioned is about the importance of active and a healthy lifestyle. People who are following a good exercise plan have a low risk of cancer coming back compared to people who are sedentary. Also, losing weight and having a diet that's healthy also helps to improve your emotional well-being as well as reduce the chance of cancer coming back. So as we are focusing more and more on early detection, we are going to have more and more breast cancer survivors. A survivor is somebody who is anywhere along their journey, from the diagnosis throughout their life, and those who are living with cancer. So the number of women living with breast cancer or number of breast cancer survivors are going to be increasing in the future. So we as providers, as well as a society, should have ways of dealing with and also taking care of the breast cancer survivors, along with other cancer survivors. Make sure that they get support groups and they get emotional and mental support during this recovery period as well as during the rest of their survivorship period. So I'm going to end here. Women are very resilient, and even if they are facing a storm, and the wind is not blowing their way, they will adjust their sails and they can prevail and they can take care of their illnesses, and they can face the storms very bravely. Thank you very much. If you have any questions.
Thank you, Sarah. That was a very wonderfully put and very nicely, eloquently. You have described most of the side effects, the complications, and the way to deal with them. The only thing I would possibly add is that since, as you mentioned, there are a lot of younger patients, a lot of young women who develop breast cancer, and many of them have not even had a child. The possibility of ovum preservation or the embryo cryopreservation is something which we have to discuss with a lot of these patients before we start treatment. And sometimes it's a very emotional journey at that point in time. They may not be able to absorb all the information, but to tell them, because chemotherapy can sometimes cause damage to the ovary and it may not be possible to become pregnant. Infertility can be one of the side effects of treatment. So nowadays, the preservation of either the ovum or the embryo, if they have a partner, then preservation of the embryo is for a long period of time is a very much a feasible option, and which is one more thing which could be added to the armamentarium. But otherwise, it's very well put and very nicely put, Sarah.
Thank you.
Thank you so much, madam, for that very informative talk, and the way you have supported your patients through their journey in cancer treatment. It's truly inspiring to all of us. Before we move to the next talk, our second chief guest for today, Ms. Reshmi Boban, madam has joined. She couldn't join earlier due to network issues. So I invite you, madam, to today's discussion. Is Reshmi Boban, madam, there?
Yes, ma'am.
Yes. So madam needs no introduction. She is a familiar face to all of us. She has been in the Malayalam film industry, and she has started her career probably with the series Jwalayai, which we all remember very dearly from the time we were kids. I request madam to address the gathering today.
Thank you, Anila. First of all, good evening to all. IRIA പിന്നെ ഞാനും കൂടി ഭാഗമായ അമ്മ അസോസിയേഷൻ ടീം സ്വസ്തി ഫൗണ്ടേഷൻ ടീം ഈ ഒരു ഇനിഷ്യേറ്റീവിൽ ഒരുപാട് അഭിമാനം കൊള്ളുന്നു. സത്യം പറഞ്ഞാൽ ഞാനിപ്പം ഈ ഒരു അരമണിക്കൂർ സാറാ മാം പറയുന്ന കുറേ കാര്യങ്ങൾ കേട്ടപ്പോൾ ഒരുപാട് മനസ്സിലാക്കി. ഞാൻ തന്നെ ഈ പറയുന്ന പോലെ എന്നോട് ബന്ധപ്പെട്ട കുറച്ച് ആളുകൾ ബ്രസ്റ്റ് ക്യാൻസറും അല്ലാതെ ക്യാൻസറുമായിട്ടുള്ള സർവൈവേഴ്സ് ഉള്ള ഒരു ഫാമിലിയാണ്. അപ്പോൾ അവർ കടന്നുപോയ ഓരോ നിമിഷങ്ങളും നേരിട്ട് അനുഭവിച്ചറിയാനും, അതായത് ശാരീരിക മാനസികമായ എന്തെല്ലാം ബുദ്ധിമുട്ടുകളും അവരും അവരോട് ചുറ്റും നിൽക്കുന്ന ആളുകൾ അനുഭവിക്കുന്നത് നേരിട്ട് കണ്ടറിഞ്ഞ ഒരു വ്യക്തി എന്ന നിലയിൽ തീർച്ചയായിട്ടും ഇങ്ങനെ ഒരു ഇനിഷ്യേറ്റീവിൽ പങ്കെടുക്കാൻ പറ്റിയതിൽ ഒരുപാട് സന്തോഷമുണ്ട്. ഇനിയും നമുക്ക് ഈ പറയുന്ന പോലെ അവയർനെസ് വേണം. എന്റെയൊക്കെ സാധാരണ ഒരു ധാരണ എന്ന് പറഞ്ഞാൽ 40 വയസ്സ് കഴിഞ്ഞ സ്ത്രീകൾക്ക് മാത്രമാണ്, അതായിരുന്നു എൻ്റെ ഒരു മിഥ്യാധാരണ, മാത്രമാണ് ബ്രസ്റ്റ് ക്യാൻസർ ഉണ്ടാവുക എന്നുള്ളതും. പിന്നെ ഉണ്ടായിരുന്ന ഒരു ധാരണ ഇപ്പം സാറാ മാമിന്റെ സംസാരത്തിൽ ഞാൻ തിരുത്തിയിട്ടുണ്ട്. അതായത് ഒരു ബ്രസ്റ്റ് ക്യാൻസർ സർവൈവറിന് നാളെ ഒരു അമ്മയാവാനുള്ള അവസരം കൂടി ഉണ്ട് എന്നുള്ളൊരു തിരിച്ചറിവ്. തീർച്ചയായിട്ടും ഈ ഒരു സംരംഭത്തിന് എൻ്റെ എല്ലാവിധ ആശംസകളും. താങ്ക് യു.
Hello.
Yes, Anila.
Yes, thank you so much, madam, for joining us today. So we shall move on to the next academic talk. We have Dr. Parvati Rajendran with us today. Madam is Senior Consultant and Charge of Clinical Imaging and Interventional Radiology at Esther Medicity. I think madam is joined. Yes. So over to you, madam.
Thank you, Anila. Thank you for having me here. Good evening, everybody. I'll just go straight into my topic. Am I audible, Anila?
Yes,
Madam, you're audible, ma'am, and even slides are visible.
Visible. So my topic is breast MRI. Actually, I am Dr. Parvati Rajendran. I am a breast imaging specialist at AMMA Kochi. So what is breast MRI and when is it used? So breast MRI is a just a minute. Breast MRI is a non-invasive imaging test that uses magnetic fields and radio waves to create detailed pictures of the breast. It does not use radiation. It provides high contrast images useful for detecting abnormalities which may not be visible in mammogram or ultrasound. So if you're planning to take a breast MRI, what is the ideal timing that you can go for a breast MRI? If it is not for an emergency, it is like an elective study. The timing is from 7th to 14th day of your menstrual cycle. Like if you take the first day of your period as day 1, it is 7th to 14th day. Then it is usually performed with IV contrast, that is gadolinium contrast. How does it work? The patient lies face down on a padded table with openings for the breast. The table slides into the MRI scanner, which uses a powerful magnet and radio waves. Gadolinium contrast is injected to highlight blood flow and detect abnormalities. This scan typically takes 30 to 45 minutes. Now, this is how the patient lies for a breast MRI. The patient is prone, that is, she'll be lying on her face. It is not very uncomfortable, of course, but lying down like this for 30 to 45 minutes is not easy also, and that too without much movement. Now, what are the things that we have to take care when we go for a breast MRI? It's not just breast MRI, any MRI. As I said, it's a magnetic field, so you have to be careful that there is no metallic object on your body. Pacemaker or implantable defibrillator. If you have a pacemaker, you have to tell your cardiologist that you're going to take an MR. And the cardiologist will shift the pacemaker into an MR compatible mode, and then only we can take an breast MR. Aneurysm clips in the brain are usually ferromagnetic. So we do not take MRI if there's an aneurysm clip. Cochlear implants, older ones are not MR compatible, but recent ones are compatible. Now, what are the indications? When do we take a breast MRI? First is high-risk screening. So what is high risk? Who is a lady with high risk of cancer? Ladies with BRCA1 or BRCA2 gene mutation, that is one. So screening usually starts for general population starts at age of 40. But a high-risk lady, the screening should start as early as 30 years, and we usually start with breast MRI. Another high-risk person is a lady with a first-degree relative of someone with BRCA1 or 2. First-degree relative means mother, sister, or daughter. And another high risk is first-degree relative of a patient who has developed breast cancer at an early age, like before 40. There are other high-risk factors also. So in high-risk screening, we use MRI. Next is an occult primary breast cancer, that the patient is suspected to have a breast cancer, like from a lymph node, axial lymph node biopsy or something like that, but we are not able to find it in mammo or ultrasound. We can do an MR and find out whether there's a small primary breast cancer. And of course, breast MRI is always a problem-solving modality. You did mammo, you did ultrasound, but the findings are not conclusive. You're not able to reach a conclusion. You can do an MR and as a problem-solving modality. Now, next is some lesions very rarely will be seen only in MRI, like non-mass enhancement. For that, the biopsy is also taken using an MR, so guidance for localization and biopsy. Next is you have been diagnosed with a breast cancer. The surgeon has to stage the disease, pre-operative staging of breast cancer. MRI is taken. Now, as Madam said, chemo is given, neoadjuvant chemotherapy, that is before surgery. Once the treatment with chemo is completed, we assess how the disease has responded, whether the lesions have completely disappeared or decreased in size. That is also with MRI. Last, of course, evaluation of breast prosthesis, that is any silicone implant, the complications of silicone implant, all these are assessed using MRI. Now, what are the advantages? Breast MRI is highly sensitive for detecting breast cancer. It is useful for dense breast tissue where mammogram sensitivity is lower, provides a detailed and anatomic and functional information, and of course, no ionizing radiation exposure. Now, this is a breast MRI, just to show you the image. This is a dynamic post-contrast image with fat subtracted image. As you can see, the right breast is normal. The left breast shows an irregular, heterogeneously enhancing spiculated mass in maybe the central quadrant. This is definitely BI-RADS 5, that is cancer. Now, this is another breast MRI where you can see that the left breast is normal and the right breast shows multiple lesions within the same quadrant. So this is a multifocal disease. Now, what are the limitations? MRI is generally expensive and not that widely available. It can lead to false positives requiring unnecessary biopsies. It is not suitable for patients with certain implants, as we discussed. And as it is a closed space, severe claustrophobia is also a limitation. Gadolinium contrast may not be suitable for patients with severe renal impairment. As I said, it's severe. If it is mild renal impairment, we can definitely use it. It is not as unsafe as CT contrast. Now, to summarize, breast MRI is a powerful imaging tool for detection and evaluation of breast cancer. It complements but does not replace mammography and ultrasound. And it is most valuable in high-risk screening, cancer staging, and treatment monitoring. Okay, that's it. Thank you.
Thank you, Parvati. That was very nicely and comprehensively put on regarding the MRI breast. Possibly my only addition to that, this thing is that there is a lot of patients, who think that MRI, they come to me with an MRI report initially. And a lot of people under the misconception that you still mammogram is the primary tool of management and MRI is more of a problem-solving tool. And it requires a lot more expertise to interpret an MRI than it requires for a mammogram or an ultrasound. So be careful where you get your MRI done from and make sure that there's adequate expertise is available before getting an MRI done, because it's not always the answer to all problems. But otherwise, yes, it's a very useful problem-solving tool and very nicely put. Thank you, Parvati.
Thank you, sir.
Thank you so much, Madam, for that very informative session on breast cancer imaging, especially regarding MRI. Now, I had a doubt, Madam. Many of these companies actually come up with devices which make use of probably ultrasound, I'm not sure, but they say that they can give a screening without radiation and pain as you have for a mammogram. So what is your take on these devices? Is it
actually, I don't remember the name of the device, but there are a few. But I think it is always, from a radiologist point of view, it is always better to avoid such things and straight away go for a mammogram. And if needed, an ultrasound along with that for any screening or even diagnostic purposes.
Because one of the complaints which most patients tell us is the pain which they experience while doing a mammogram. So I cannot vouch regarding the pain, but most patients come tell that it's a very painful procedure and ask for any alternative. So even when we tell them to do a yearly mammogram, they're like, please recommend something else. We don't want to go through the pain again. So would a ultrasound be good enough for screening?
Actually, the WHO recommendation is always mammogram, Dr. Anil, actually, because very early detection with just microcalcification, just before the stage of a mass forming or something like that, it happens only in mammogram. If you develop at least a 1 centimeter sized lump, we can definitely pick it up in ultrasound. But screening definitely better is mammogram. And regarding the pain, actually, our technologist usually asks the patient, are you comfortable? It has to be compressed. That is a fact. Only if it is compressed, we can get a good image. But it's always important to make the patient also comfortable. She has to come for another mammogram next year also. So usually we tell our technologists, please ask them if you're comfortable with this compression, then only you compress more, or else you stop with that.
Yeah, that's a very good thing. If you tell the technicians to compress too much, I
Yeah.
actually tell the patients to take a tablet of paracetamol and go. I don't know
Oh.
if that helps, but some say that it is okay. So yes, we'll keep that in mind, and probably we should also educate our technicians regarding the pain related. Only those who have taken will understand the pain. So
Yes, exactly.
that is a very good take-home point, ma'am.
Anila, sorry.
Yes,
Regarding
sir.
the other this thing that there are a lot of devices coming up using thermal imaging and using some other
Yes.
technologies which have really not been proven. See, they can replace breast self-examination, they can replace physical examination of the breast to some extent, but they cannot replace, so far, none of them have been proven useful to replace either mammogram or ultrasound. You still need to do a mammogram to confirm the finding. It can be used as a general screening tool in places like when you're doing a large-scale camp where you want to just do, where a health worker just wants to do a physical examination of the breast. Instead of doing physical examination, you use some of these devices which use thermal imaging based on body temperature and the temperature of the breast. But again, they have not been reliable, very reliable as of today. And studies are still going on. A lot of people are trying to devise newer techniques to make the screening process less painful. That is something which is a lot of research going on. But right now, we still have to rely on the mammogram as it stands today.
Yes, sir. Yes, sir. Sir, I had a question for you, sir. Sir, we have been seeing that the number of young patients with CA breast have been rising over the time. So, is there any specific reason? Now we see females in 25 coming with breast cancer. Probably, is there any reason which could be attributed for that, sir?
Whether it's a true increase or not is the debatable thing, because we have a predominantly young population. Just because we have a very predominantly young population, we'll find the number of young people with breast cancer also higher. But it is true that we have a slightly younger population when compared to the West. And it could be the exposure to carcinogens, it could be the genetic risks that we have. We're still not sure exactly why we have this thing. But is it truly an increase, a true increase, or because almost 70% of our population is young? The older population, like in Kerala, maybe now we have slightly more older population, but generally, majority of the population we have is young. That is why we tend to get a more younger population. Is one of the beliefs that it's not a true increase in younger population. But in the West, you find a lot more. The older population is much higher. Almost from 60% of the whole population is a older age group. So that's when you look at the relative proportions, you may not find that much young patients in the West as compared to. But I don't think it's a true increase in the young age as such. But yes, the exposure to carcinogens in the atmosphere, in the food, in the air that we breathe is increasing, and therefore automatically the risk factors are increasing with so-called progress in society that we have, whether it's pollution, environmental, or it is otherwise.
Yes, sir. Yes, so because even I was concerned, I told my medical oncology friend regarding the rising rates in heart attacks in
Yes.
young males. So he came up with the statistics of young females developing CA breast and asked me to go get screened. So even I had the concern, is there any specific reason for this increase in number?
Not really. Not that we know of that there's any specific reason, only for young people as such.
Okay, sir. I had a question for you, Sarah ma'am. Are you still there? Sarah ma'am?
Yes, I'm here.
Yes, ma'am. So we have worked both in West and in Kerala. So often we find that when a diagnosis of cancer is made, somehow they undergo surgery because they want the lump out. But when it comes to chemotherapy, they always think of alternative options like alternative medicine. It's quite common in India, but is it common outside also?
Actually, it's not that uncommon in the Western countries also. I think it's human mind mentality is the same. If you propose a treatment plan and they will try to see if they can do anything else other than that. So there are still a significant number of women going for other shortcuts with substituting chemotherapy. So the same question everybody asks all the time. The doctor said, the surgeon said everything is removed. Why do I need chemo? It takes a lot of convincing. Actually, maybe it's a little easier to convince a Kerala woman than the EU Western women if they are really uh, uh, in a mindset of not getting chemotherapy. It's they are quite stubborn, so it's difficult to change their mind. But with our women, I think what I've seen is you could convince them if you. I think here people tend to trust their doctors more, and then they probably will obey your instructions if you are, if you can explain it to them, and then but it is universal. Women have a tendency to fight getting chemotherapy and go for other alternative therapies, and in the end come back with an advanced stage, and then it's too late at that time for a
Yes.
cure.
So as you said, awareness has a very important role to play in getting the proper treatment. We have our guest here, Daisy ma'am. Do you think our associations can probably, like we have our meetings here today, to take the idea to the general public that cancer needs proper treatment rather than alternative medicine? So Daisy ma'am and Reshmi ma'am, media has an important role in spreading awareness regarding cancer treatment. അപ്പം അതിനെപ്പറ്റി എന്തെങ്കിലും ആഡ് ചെയ്യാൻ പറ്റുമോ മാഡം? Are they still there? I'm not sure. Yes. Daisy ma'am has worked with a lot of associations even for cancer treatment and support groups. Daisy ma'am, are you there? Sure. And again in media, because ഈ പറഞ്ഞ പോലെ സീരിയൽ ആയാലും സിനിമ ആയാലും നമുക്ക് ഈ tobacco chewing comes up all the time. When we go for a movie, but maybe we can actually have short clips regarding breast cancer awareness as well as regarding screening and the importance of getting proper treatment for all these any malignancy per se, rather than going to alternative medicine. Because most people, even educated people, have actually, even my own relatives have come and asked me, chemo or is there any method we can avoid that? Because as you rightly pointed out in your presentation, the picture which comes is the loss of hair. For any female, that's devastating. So the loss of hair, the totally bedridden condition, and that's how, and maybe it's partly correct also. So that has a very negative impact on the, especially on regarding the chemotherapy part. And they always ask, is there any method to avoid it? Rather than maybe surgery, somehow they'll go through it because they want the disease out of the body. But when it comes to chemo, there is a huge stigma which is still there. So one of the things what we try is we try to make them imagine the scene which comes after the treatment. Like after the treatment, your hair will come back, or like after the treatment, you can go back to your normal life once everything is fine. So maybe we can actually have public awareness campaigns also regarding proper treatment of cancer. Probably Swasthi Foundation and AMMA will do something for that.
I think that's where the survivorship and also support group programs are going to be useful. We can tell them that it's not going to be that bad, but if somebody who has been through the journey, like a cancer survivor, they tell patients that, I've been through this and this is not that bad. So that's why the support group systems are very active in the US. So we should, I think it was the AMMA, that's something that we can think about doing, make a cancer survivor or support group, breast cancer support group from survivors who's been through treatment, and then they can, encourage each other and also encourage people who need treatment. So it's always important to have that kind of a support system.
Yes, so maybe Vijay Kumar sir is a pioneer oncologist in Kerala. Maybe with all your patients alone, if you start a support group and then expand it, we can include all the other patients, and then maybe if we have a common cancer registry for Kerala where every cancer patient gets enrolled and they can act as a support system for each other. Be
Very
helpful.
true, very true. We do have a support group which is reasonably active, but as I said, what we must remember about chemotherapy is that not everybody needs chemotherapy. You know, when we say we need chemotherapy, adjuvant chemotherapy especially, maybe 7 out of 10 people need it. There are 3 people who don't need it. But we have no foolproof way of identifying those 3 who don't need chemotherapy. So that's why you'll always find somebody who escapes the net who says, I went and took some homeopathic treatment or Ayurvedic treatment or some sujok or some, what is that, some other form of treatment, alternative medicine, and they are so-called cured. And there'll be 10 people who listen to that and then go and get the same treatment and not get the same effect. So it's very difficult to unconvince. But I believe that some of these local treatments, you cannot totally disregard totally also, because if a patient has a lot of faith in it, it does help to improve the body's, the belief in the treatment. As long as they take this full treatment along with that treatment, I'm okay with them. If they take some Ayurvedic treatment after the completion of treatment, if they believe in it, it does help their immunity a lot, is what I feel. But again, this is all in advisement only. We cannot really say this thing. A support group is definitely a good idea, and there is support group, but to keep them active for a long period of time is always a task in itself. They are very active when they start off, and then it becomes a little slows down. We have started the support group almost 3 times now, and they've been reasonably active for some time. Then they tend to become, they get caught up with their own work and household activities and things like that.
Yeah, so maybe like Swasthi Foundation or some
Yes.
like they can start up a support group system also, whereby they can encourage other patients to
Yeah,
be.
and in this era, I think it's very easy with the social media and things like that. It's easier to connect, and maybe we can expand the support group to a much wider base now.
Yes, sir. Yes, sir. So with that, we are coming to the end of today's session. So before we end, just a few words for the cancer survivors, as well as each and every one of us who have been supportive for them in their journey. She wakes with courage in her heart, though fear may try to steal her rest. A gentle smile, a steady pace. She meets the world with quiet grace. The path is hard, the road unsure, but love and hope remain her cure. With these words, we come to the end of today's session. Thank you so much, Vijay Kumar sir, Sara madam, Parvati madam, Daisy madam, and Reshmi madam for joining in today's session.
Thank you.
And we'll continue to again tomorrow with a new group of experts, and probably till the end of this month. Thank you so much once again. I'm Dr. Anila Trisa. I'm a gynae oncologist at Sri Gokulam Medical College. Thank you so much for joining today.
Thank you.